augmentation. Now, when I first made a video and when I first posted a video on buttock augmentation using the technique that I do, there were a lot of people who asked me whether these were really breast implants, whether they are I'm using breast implants for buttock, and people did not have really any information about cohesive gel implants for buttock. For so many years, the only implants that were available for buttock augmentation were the solid implants. But these implants, I used to hate these implants, and patients also never used to like these implants because they were as hard as rocks, and they were very distinct to feel. On touching or feeling, it was very easy to make out that it's not something natural. It used to feel very artificial, and it used to look also very artificial. So the implants that are being used now at our center, these are called as cohesive gel implants, and I'm going to show you an actual video of the implant where I'm doing this on the implant, and you can see that the implant is very stable. Being a gel implant does not mean that it's a weak implant or that it can leak or it can puncture. These implants are form stable, they don't change the shape or they don't change their size, and therefore the result is for the lifetime. So today's topic of interest is going to be how effective is silicone implant for buttock augmentation. So silicone implants being used for buttock is nothing new. There have been many types of implants that we have been using for so many years now, and buttock augmentation is one of the most commonly performed procedures at our center. And buttock augmentation relies on two main things. One is an implant, and the second is fat. If anybody has enough fat in any area of the body, such as the tummy or thighs or the back, we can remove all this fat by liposuction, purify the fat, and re-inject it into the buttocks to augment or enhance the buttocks. So the idea of enhancing the buttock is nothing new, but amongst the two options, the focus for today is going to be on the use of silicone implants for buttock augmentation. Now, I always say that the buttock augmentation procedure is something which is celebrity driven. It is driven by the attention that the media gives to these celebs when they keep posting photos of themselves having a good time on the beach or when they are wearing bikinis, and their body shape is what attracts a lot of viewers. And you can see that there are lakhs and lakhs of likes in each of these posts that these celebrities keep creating, and they have become a household name, and they have become very famous by the type of their body. Now, when we actually look at the shape of buttocks, there are different shapes which have been described. So some people have what is called as a square buttock. So in a square buttock, there is a lot of fat in the waistline here, and then the buttocks are almost at the same size as the upper waistline, thereby giving a certain squarishness to the buttock. And of course, there are people who have round buttocks and those who have a V-shaped buttock. Of course, the ideal proportion is the heart shaped, where the waistline is very narrow and the butt size is bigger, and that's what the aim is, to create an hourglass shape or to create a heart shaped buttock. Now, when we have to use implants for buttock augmentation, we have to understand that not each person has a conformed size or shape of the buttock. So we have to first examine the patient. We have to decide what is the shape that the person naturally has, and then we can enhance the shape of the buttock. So there are different types of shapes of implants which are available. So the first one, what I have shown on the left, is a biconvex implant. The one in the center is a round implant, and the one on the right hand side is a teardrop or anatomical implant. By the use of different kind of implants, different shapes, we can make sure that the implant matches the shape of an individual, and therefore it looks much more natural and it conforms to the shape of that individual's body. These implants generally are subcutaneous. Subcutaneous means they are above the muscle, because there are a lot of main blood vessels and nerves which pass from under the muscle and therefore these implants are normally not placed under the muscle, they are placed above the muscle, for the simple reason that if it's too big an implant, it can compress on the nerves or on the veins in the buttock which pass to the lower limb and can cause problems, because the plane under the muscle is very small. Therefore these implants are never completely under the muscle, they are either partly under the muscle or they are above the muscle, called as a subcutaneous implant. Sheetal Srivastav is saying, sir, you are the best surgeon. Thank you Sheetal for tuning in. I hope you find today's session to be informative. So this is how we plan the positioning of the buttock implant. So when we do the planning, it's very important to arrive at the correct location of the implant. We don't want the implant to be too low. We don't want the implant to jut out from the side. It has to be exactly in this portion of the buttock, which is the flattest part of the buttock. For this, we have to understand that buttocks have a tendency to sag, same like the breast, and therefore the volume always tends to be more in the lower part and less in the upper part. So the positioning of the implant is in such a way that improves the volume on the upper pole, and therefore the implants are positioned in a manner which will give more fullness, more projection to the upper part of the buttock as compared to the lower part. And I am going to show you some videos on that. So when I tell patients about these cohesive gel implants for buttock enhancement, they have a little bit of difficulty in believing when I tell them that these implants are very stable, they don't break, they don't leak, they don't rupture, because the gel in these implants is very solid. It is not a gel which is in liquid form or which can easily puncture or it can leak. So I made a small video just to show you all how it feels when you press or when you punch these implants rather. So this is me, and I am punching the implant, as you can see, and no matter how much pressure I am giving on this implant, or no matter what kind of punching I am doing with the implant, it does not change its shape, it does not get broken, it does not rupture, it does not leak. So these implants are very stable. This is another small clip where the implant has been cut, and you can see that even after cutting the implant into two halves, it does not leak. And that is called as a form stable gel implant. Christina is saying, I have cohesive gel implants since 2017. Thank you, Christina, for tuning in today. And it's good to have you on our live show today. So cohesive gel implants are very form stable, and it doesn't cause any interference with the body, it does not trigger any immune response, and the result that is created remains for the rest of your life. Now, when we talk of butt enhancement in particular, the incision is planned in such a way that it is completely concealed in the butt crease. So the incision lies somewhere between the two buttocks here, and it's made in such a way that we get good access to both the pockets. So after taking the incision, we reach the muscle and then dissect on the surface of the muscle to create the pocket, which is the circle which I have marked on both the sides. And when both the pockets have been created, then we proceed with insertion of the implants. So let's take a look at the kind of result that we get immediately on table after the butt augmentation procedure. So this is a small clip showing the result that has been obtained after a butt augmentation procedure. You can see that the stitches are still raw, it has just been performed, but look at the kind of projection. And this is something which can really transform the curvature of the waistline or the curvature of the back, and this is what a lot of women really do desire. These are some photos of the same lady a month after the procedure, and you can see that the implants have given very good volume to the butt. You can see it better in the profile. So in the profile view, you will realize that initially there was a lot of flatness in the buttock, and after the augmentation there is a good volume and good projection on the butt. Now, because these implants are not going to shift in place, they are not going to get dislodged, disrupted, nothing is going to happen to them, these results can almost remain the rest of our life. This is another patient who had had some massive weight loss. She had lost around 20 kilos of weight, and when she came to me, her concern was about the sagging in the butt skin, and she was very unhappy in wearing certain bikinis and certain other outfits where she was not comfortable with the wrinkly appearance of her buttock. So we discussed both the options, fat injection as well as implants, and I found that she did not have much of a fat to really give a good contour to the buttock. So of course we did a little bit of lipo on the waistline, because if you notice, the waistline is bulgy in the beginning and now it is contoured a month later. But along with this waistline contouring, I also offered her round butt implants, which have sort of filled the wrinkly skin or the loose skin on the buttock that she had, and you can see it better in the two-third profile. Look at how flat the buttock was, or look at how loose the skin was, and she was really having a tough time wearing certain kind of outfits. And you can see after the butt augmentation, she has a proper projection on the buttock, and she can carry out wearing certain outfits with a lot of confidence. This is the other profile. So these are 440 cc round cohesive gel implants for buttock enhancement, and you can see the kind of result that she has had after these implants. Let's move on to another lady who already had some kind of dimpling on the buttocks because of cellulite, and she came to me not only for enhancement of the buttocks but also to address these dimpled and cellulite areas. And it's a very common problem in a lot of women. No matter how much you exercise, no matter how healthy you eat, it's not really easy to get rid of cellulite. So what is the procedure? The procedure is to stretch the skin out such that the skin becomes smooth and the appearance of wrinkliness or the appearance of cellulite improves. And at the same time, we did some liposculpturing. So we sculpted her waistline to make it narrow, and I injected a little bit of fat in her hip dips to give her a proper hourglass shape. And of course, in the central part, in the buttocks, we have inserted implants. So this is also called as a composite butt augmentation. Composite because it's a combination of fat as well as implants. You can see the profile view where you can see that the sagginess of the buttock or the dimples on the buttock have got corrected by the use of properly positioned implants, and the waistline has been nicely sculpted to make it concave, and the hips have been augmented by injecting fat. So this is a procedure which has to be done in totality, taking into consideration the shape that a person's body has, and trying to make the most of the fat that is available and take the help of implants wherever the fat is not that much in proportion. This is the other profile, and you can see the kind of change or the kind of result that one can have with use of gluteal implants made of cohesive gel silicone. Now this was another lady whose concern was that the buttocks were not tear shaped or not pear shaped, and she wanted a particular type of shape on the buttock, and this is what we could give her by the use of 300 cc implants. So you can see that the butt shape is much more natural, though it's not mainly for increase in size, but it's mainly for the shape. You can see it also in the two-third profile that before the surgery she had a kind of flatness on the butts, and after the augmentation she is now much fuller on the buttocks, and she was very happy and thrilled with the kind of result that she got with buttock augmentation. Now buttock augmentation does have its share of problems, and it will not be fair if I finish my talk without explaining about what problems one can have. The most common problem is infection, because the area is such that it's very close to the anal area. So it's very important for the patient to maintain proper hygiene and thereby minimize the chance of getting any infection. Wound dehiscence means breakdown of the sutures and exposure of the implant. So wound dehiscence can also happen if proper care is not taken in the recovery period. So what does the recovery involve? So we don't want a patient who has had a butt augmentation to lie down flat or supine on the buttocks at least for 1 week. You can sleep on the tummy but not on the back. No sitting is allowed at least for 1 week. You can walk about in the house, but no sitting on hard surfaces like a wooden chair, or no sitting in fact for at least a week. So once you follow these precautions, then wound adhesions can be minimized. The other complication or the other problem one can encounter is seroma formation. Seroma means accumulation of lymph around the implant, and with the current generation of implants, the incidence or chance of getting a seroma is very less. Implant exposure is mainly something which was seen with the solid implants, and it had more to do with the type of implant than the technique. Malrotation means the implant turning into its pocket, and this turning of the implant can happen sometimes in a teardrop or anatomical implant, not so much with round implants. But of course, it is not that the butt augmentation procedure has only problems. There are plenty of advantages. The main advantage being that there are no life-threatening complications. You must have heard of some adverse reaction to fat being injected into buttock. There have been incidences of it causing some life-threatening complication, threat to life, when the fat was injected in the buttock. But with implants, you can be rest assured that it cannot cause any life-threatening complication. These implants are absolutely inert, so they do not cause any adverse immunologic reaction. They do not interfere with any of our bodily functions, and they last for lifetime, as I said, and they feel extremely natural. So use of implants for butt augmentation is something which is catching on, and I see in my practice that a lot of patients are coming forward and inquiring about butt augmentation. This procedure is done normally under general anesthesia, and it takes around 2 hours to finish the procedure. After the surgery, you are given a corset to wear, which is like a body shaper, and that corset is something which you need to wear all the time, at least for a month. You can resume walking from the very next day. Sitting or sleeping on the butt area is not allowed for at least a week. Gentle exercises can be resumed after 3 weeks, and those of you who are into hardcore gymming or very heavy exercises, they can resume their workouts after a month or month and a half. Butt augmentation is a very satisfying procedure for the patients, and your wardrobe can have a dramatic transformation when a butt augmentation surgery is performed. So I hope you found this information about use of cohesive gel implants for butt augmentation to be of use to you. And if you have any other queries related to butt augmentation, you can feel free to write to me in the comment box, and I will revert back to you with my reply. I thank you all for attending today's live session, and I'll be back soon with another topic of interest. For those of you who like to listen to the lives that I do follow me on Instagram on Dr. Parag Telang, and the clinic Instagram ID is designer.bodies.1. You can follow us on the clinic ID as well to get latest updates of the offers and other things that we have. Matthew is saying thanks Matthew for tuning in tonight. I hope you found this session to be interesting. I thank you all once again for tuning in, and see you soon next week with another topic of interest. Till then, stay tuned, good night, and take care.